Hi, I'm Dave Fornell, a digital editor with Cardiovascular Business, and I'm here with Charles Fraser. He is the executive director of the new Institute of Cardiovascular Health, which is a collaboration between Ascension Texas and the University of Texas at Austin. This new state-of-the-art cardiology program will fully integrate the heart team approach into treating patients. And I wanted to find out what you're in the process of doing and how do you build a heart team from scratch this day and age?
To say that we're building from scratch is probably not entirely accurate. There have been a lot of really good doctors here and doing their best to take care of patients, but what we're building is an integrated program where we coalesce all the elements of cardiovascular care, administration, facilities, research personnel, educational programs, all in one cardiovascular enterprise.
It sounds like you have an existing interventional cardiology program, general cardiology, and a pediatric component. So what are you having to build off of that, and what are you hoping to include in the next couple of years?
We started 4 years ago here at Dell Children's Hospital to build an integrated congenital program. So we call ourselves the Texas Center for Pediatric and Congenital Heart Disease, where we have surgeons, anesthesiologists, critical care doctors, advanced practice nurses, OR staff, perfusion staff, research staff, intensive care. I'm sure I'm missing somebody, but you get the point. Everybody focused on patients with congenital heart disease. On the adult side, meaning the adult acquired side of the cardiac continuum, there is a formidable group of adult cardiologists here and some very good legacy doctors that have been taking care of patients, but it hasn't been an integrated, coordinated program. So what we're doing is we're building structure and function and establishing a new paradigm of analysis, so performance analysis. And with the development of the University of Texas Dell Medical School, we're integrating the research prowess of one of the greatest public research universities on the planet. And so not only do we seek to deliver the very best possible integrated care, we want to take on the challenges of cardiovascular disease. And unfortunately, Dave, despite the enormous amount of money that we spend in our country and worldwide on cardiovascular disease, there's some pretty sobering statistics, like life expectancies for males in the United States is actually down over the last couple of years and flat before that. Cardiovascular disease is still the #1 killer in our country. The morbidity that's associated with cardiovascular disease is profound, yet we spend more and more and more. And the United States doesn't compare that favorably if we look, to our peers around the world. So there's no question that the proposition needs a shakeup. And so we think that offers a great partnership here between a large healthcare system, meaning Ascension, and a great public research university. It seems like the right sort of magical marriage.
It sounds like you had kind of a disjointed system with, you had clinicians and you had these specialists in various areas of cardiology, but it sounds like there's a lot of referrals going on.
Yes. I mean, I think the situation that existed here is pretty standard. And that is a lot of people come together and they try to work together and they try to coordinate care, but there's not an entity that focuses approach. And so what we seek to do is to get everybody on the same team, stating a common vision, and then working cohesively to achieve that vision. And this will be a never-ending refinement proposition. But the idea, again, is to have a focused, dedicated team. So if you're part of the institute, you're clear on what your charge is.
The heart team approach I've seen probably most pronounced on the structural heart side of things has really developed in the interventional world over the last decade,
Yes.
where you have your cardiac surgeon, you have your interventionist, you have maybe a nurse navigator, your radiologist involved, to where everybody's kind of putting their 2 cents in to evaluate a patient, decide whether they qualify for TAVR, then actually following them through the continuum of care all the way through to discharge and rehabilitation. And it sounds like you're taking this approach to the next level. So it's going to be all of the subspecialties within the cardiology department.
Absolutely. You've said it just perfectly. I mean, the heart team that's grown up around structural heart disease, which is an interesting term to begin with, but nonetheless, that largely developed, as you correctly stated, around TAVR. That's kind of a microcosm of what we propose. And that is, we bring in intensive care, anesthesiology, OR nursing, perfusion technology, our outcomes analytics team, of course, our administrative team, our educational component. So we've already started doing that here at Dell Children's Hospital, and it makes for a very robust environment. In fact, if you were to come into our rounds tomorrow morning at 7, you would find the entirety of our heart program reviewing every patient that's in the hospital. And that's novel in my experience. I've been in some great places, but I've never been in a place where every single patient every day is reviewed by the entirety of the heart program. And everybody has something valuable to contribute to the proposition. And it also provides for a basis of understanding of the care continuum. And then that's just hospital-based care, right? So, of course, we spend, thankfully, the majority of our lives not in the hospital. But if we think about the lifelong proposition of some of these disease challenges, we should be thinking holistically about the entirety of the lifespan. Now you're talking to a pediatric heart surgeon here, where I meet children as fetuses, sometimes as early as 20 weeks gestation. But if you think about their life, I mean, we're talking about hopefully 8 or 9 decades of a care continuum. And that's where we think we have a really interesting opportunity here to think about longitudinally. And then we think about more advanced stages of life. We've focused, unfortunately, in society, we look at things like mortality statistics, we look at things like length of stay statistics, but we don't talk much about what people actually want to hear, and that is, how are they going to be doing? How are they going to feel? What is their quality of life going to be like? What things can we do to focus on returning people to a normal and hopefully satisfying quality of life? And so, again, that's a broad, high-level aspiration that we have for this program, but we do think that we can move the needle on this.
And how about the economics of it? It sounds like there's not an integrated program like this in Central Texas, so you guys are looking to build one. But in order to attract talent in and to build it, what is the economics of building this program where you're at, and also for being able to recruit physicians and experts around the country?
Well, I think the profile is enormously attractive. There's Austin, Texas, and Central Texas are growing exponentially. That's widely known. This is the home of state government. This is the home of University of Texas. This is the headquarters of Ascension Texas, which is a 14-hospital system. It's a large footprint. And of course, Austin has become a very entrepreneurial environment with some very notable, innovative companies here. So when we talk about building something new, I mean, I promise you, I get a lot of inquiries. What is going on in Austin? And, could I be a part of it? So again, the test case for that has been this pediatric program where we have literally recruited hundreds of people here to join the enterprise. And we expect the same thing will be true on the adult side. Now, the economics in terms of resources is an investment. Ascension is making an enormous investment in Central Texas, in people, technology, facilities. University of Texas is making an enormous investment. Financial resources are a mutual proposition. And, the shared vision is bold.
What about capital investments? Are you looking to have to build out cath labs or EP labs or ORs and things like that?
Well, we have existing quite acceptable facilities. I anticipate that as programs grow and volumes grow, there'll be additional investment in facilities. We're here at Dell Children's Hospital. We've in the last 3 years, we've built new cath lab, new operating theaters, new intensive care unit. We're already outgrowing that. We're building an additional intensive care unit. We built a transplant team, a lot of other things. Same thing will be true on the adult side. Ascension is building a new women's tower at their main community hospital, which is called the Main Seton Hospital. We're building a hospital north, Children's Hospital in North Austin. So there's a lot going on, but it never stops. I mean, the population is going to demand the right facilities and convenience and whatnot. So it's an exciting time to be seeing this all coming together.
Well, I appreciate your time.
Yeah. All right. Well, thank you for checking in.